laryngeal hemiplegia, what causes it? So most of the time it's usually naturally occurring and we don't know why. So it could be, this is what we call idiopathic laryngeal hemiplegia. But a genetic cause has been proposed because we did mention larger horses being a key component. There are also irritating agents in the neck musculature, guttural pouch diseases, you have neck surgeries or trauma, neck abscesses, neoplasms, anything related to the neck like strangles, poisoning with organophosphates, plants, polyneuropathies. So I guess issues with the nervous system. So in terms of pathogenesis, in normal horses, what happens is the way the disease develops is when the horse is exercising really intensively, the rima glottidis dilates to maximize airflow, as we mentioned. What happens is when you have full arytenoid cartilage abduction, which is the full opening, when it's sustained, despite the increasing negative inspiratory pressure that's going on inside because of the intense exercise, horses with this disease can't achieve this maximal abduction or maintain it because the arytenoid cartilage is affected. So what happens is as the negative inspiratory pressure increases inside, the rima glottidis progressively reduces in size and then more rapidly than in normal horses with the same workload. So this causes early musculoskeletal fatigue and poor performance. So yeah, exercise intolerance will definitely be one of the factors, especially during high speed exercises like racing. You'll have abnormal inspiratory respiratory noises like a single tone whistle or roaring. So this is the result of turbulence created by the narrowed rima glottidis. So just imagine air's going in a narrow space, it's going to cause a whistling or roaring noise because it's passing over the affected vocal cords and ventricles as well, which act as basically a resonator. So it's not just the air, it's also what they pass over, which makes it resonate, so the ventral cords and the ventricles. So we diagnose it by palpating the larynx. The slap test we'll find out, and a definitive diagnosis is made through endoscopy during rest and exercise. So palpation, you'll see atrophy of the left cricoarytenoid muscle. I can't say it, I'm so sorry. And it results in a prominence of the muscular process of the arytenoid cartilage, and it won't be symmetrical on both sides. With the slap test, what the hell is that? So you slap one hemithorax, which causes a reflex of adduction, so narrowing of the airway, of the muscular process of the arytenoid cartilage on the lateral side. What happens is this reflex doesn't exist in animals with lesions of the ascending cervical spine tracts, the central nervous system, motor nerve supply, to the larynx. So it's used in the diagnosis of even cervical vertebral stenotic myelopathy, which can be an etiology of this, as we mentioned, and other spinal cord lesions, and also what we call idiopathic left laryngeal hemiplegia, which is at the bottom. And you also have resting endoscopy and slap tests. So yeah, you're not only going to stick an endoscope up a horse's nose, you're going to slap it too. So to assess the arytenoid cartilage movements, you have to allow the horse to swallow, and it says nasal occlusion can be helpful. So in the normal horse, what you'll see is full abduction, so it'll be a fully open, of the arytenoid cartilages because it's swallowing the endoscope. But what happens is when you have prolonging nasal occlusion for several attempted breaths, it can also cause maximal abduction of the arytenoid cartilages in normal horses. So yeah, this shows you dynamic endoscopy, so it's done on a treadmill or over ground. So this is called a video endoscopy. So this poor horse has a camera up its nose while it's running. Jesus. Anyway, so laryngeal hemiplegia occurs in several stages or grades, and it's classified as the Haber-Meyer-laryngeal grading system, so remember that. So grade 1, this is it. So all arytenoid cartilage movements are in sync, they're all symmetrical, so nothing seems out of place. You have full arytenoid cartilage abduction, it's fully open, and it can be maintained. With grade 2, arytenoid cartilage movements are asynchronous, so this is going in more than say this, or the larynx is not symmetrical at times, but full arytenoid cartilage abduction can be achieved even if we can't see it here. It also mentions grades within grade 2, so we'll talk about that. So grade 2 A, it mentions transient asynchrony, so this means these aren't in sync. You also have delayed movements. In the second grade in grade 2, so grade B of grade 2, you see the rhemoglottitis is asymmetrical, so it's kind of similar because you have less movement of the arytenoid cartilage and the vocal fold, and there are occasions, especially after swallowing or nasal occlusion, when you have fully symmetrical abduction, which can be achieved and maintained. Grade 3, oh, it has 3 subdivisions. That's just great, isn't it? So you have arytenoid cartilage movements. They're not in sync. They're asymmetrical. You have full arytenoid cartilage abduction. Sorry, it cannot be achieved in grade 3, so it can be achieved in grade 1 and grade 2. Now, if we do the subgrade, so grade A in grade 3, basically you see asymmetry of the rhemoglottitis, which we kind of mentioned for A and B for grade 2. And because the arytenoid cartilage can't move as much, and the vocal folds as well, and during issues like occasions like swallowing or nasal occlusion, you can see that unlike grade 2, full symmetrical abduction, so opening of this hole, is not maintained or achieved. In grade B of grade 3, you see arytenoid abductor muscle deficit and arytenoid cartilage asymmetry, and full abduction, so full opening, is never achieved. And finally, with grade C, you see very obvious but not total arytenoid abductor muscle deficit, so the muscle is like not really strong. You see arytenoid cartilage asymmetry with very little arytenoid cartilage movement, and full abduction is never achieved. So just to remember, with grade 2 there's asymmetry, grade 3 there's the same, but you can't fully achieve opening. Grade 4, oh my god. Yeah, I mean, that tells you everything, isn't it? Complete immobility of the arytenoid cartilage and vocal folds. They are not moving. Yep, and those are all the pictures. Very helpful. I think we can guess, like, you know, this is obviously like grade 4, it's barely open, whereas like grade 1, it's fully abducted. So we need to treat this surgically ASAP, but I think I'll stop it here.